I'm Dr. Kevin Klug with Salina Regional Orthopedics and Sports Medicine Clinic, and I'm here to talk about our new treatment, Shockwave Therapy.
Well, Dr. Klug, thank you so much for coming on the show. We're going to be talking about a fairly new treatment you're doing at the Orthopedic and Sports Medicine Clinic, the Shockwave. Why don't you tell us what is Shockwave and what are you using it for?
Yeah, perfect. So I think Shockwave, simply put, is it's a high energy impulse that's delivered directly to a tissue of concern. So whether that's an old injury, sometimes used in acute injuries, but less commonly. But essentially it's a tendon, fascia, or bone disorder that's not healing well on its own. So we send that impulse to try to stimulate your body to heal it better over time.
So this is not just for pain relief, it's actually helping it to heal.
Yeah, correct. You can get some pain relief even the day of. Oftentimes when patients leave, they do have an improvement in their pain pretty immediately. That is not really the long-term goal of anybody's treatment in orthopedics, while helpful still. Really the goal is long-term, triggering your body to use its own ability to heal yourself over time.
Well, you mentioned some of them, but what type of injuries are you seeing patients with?
Okay, so the most common thing you'll see in the literature would be lateral epicondylitis for the elbow. It is more broadly applied to both rotator cuff tendinopathy, patella tendinitis, and then plantar fasciitis is another big one. Another common would be calcific tendinitis, which is a real sudden kind of painful condition in the shoulder without a lot of great treatment options. Shockwave is climbing in the ranks in terms of early treatment for that as well. I do think it's important for me to kind of educate patients that we have two machines at Salina Regional Orthopedic and Sports Medicine. So we have what's called a focal machine and then a radial machine. So the focal machine is your true classic Shockwave. The radial machine is, while still very good, probably better for myofascial pain, so just large muscle groups. The way I picture it in my mind is the focal machine is kind of like the center of a dartboard, right? You can treat very locally, get very deep penetration, large energy, so it stimulates the most out of your cells, and it can even stimulate bone. The radial device kind of spreads that wave out across a larger area, so you can cover more ground in a shorter amount of time. And I make that distinction because there are a lot of new devices up and coming as Shockwave becomes more interesting across all of orthopedics. So when you're looking for Shockwave treatment, I would just try to objectively look at that and know what device is right for you.
Okay, if somebody is a candidate, how should they go about?
Yeah, so they're welcome just to give our clinic a call. We do not require a referral, but they're welcome to call just to schedule and either learn more about their disorder and all the options, and that can include Shockwave.
Well, Dr. Klug, thank you so much for some great information, and thank you for watching. For more information, visit SalinaRegionalOrthopedicClinic.com or SalinaRegionalSportsMedicine.com and follow them on Facebook and Instagram.